I'm Barbara Hunter. I'm here today with Kim Dockery, our Chief Academic Officer, to talk about the mental health resources available to our students and parents. Welcome.
Thank you. Good to see you.
Good to see you. Before we talk, Kim, about the mental health resources, give us a sense of where the mental state of our teens are today in Fairfax.
We give the Youth Risk Survey in conjunction with our partners at the county, and we give it every year to students in 6th, 8th, 10th, and 12th grade. And so we have some data that is both cohort data and longitudinal data to look at how students are doing in a number of areas. And one of the areas is in the area of mental health. And we see that our students do have a slightly above average report of feelings of sadness and depression. And we know that certain assets like an adult to talk with, working in community service, a teacher saying good things about your work, we know that when we intervene early around this mental health issues, 80% of the students do respond. So it's important for us to make sure that we have resources available for both students and parents.
So let's talk a little bit about those. What exactly are those mental health resources?
Well, I think one of the things is that we've been building a resiliency website. And on that are places that teachers, students, parents, community members can go to find resources, people to call, things to do. We also have on our mobile app a crisis link, a little square that says, here's who to call. Every web page for every school has also a box for crisis resources or mental health resources. And this past year, we've added a few new things that I think are both exciting and important for us to let people know about. The first one is a product called Cognito. It's a simulation, and it's for teachers, parents, community members, and it takes you through simulations of how you approach and talk about difficult conversations about mental health issues. The exciting thing about this is the Fairfax County government, in working with us, has made this free to the community for the next 2 years. So you can go on, I did it, and you actually are going through a simulation, and you click on the student and you get coached and ask you questions, and they actually give you feedback and say, you know, that's one way to try it. Have you thought about asking this directly? So it's a really, really helpful thing for adults, and our teens are actually going to be helping pilot a peer-to-peer product with them as well.
That sounds awesome. I wish I had had that when I was raising my teenagers.
Me too. Me too.
Tell us a little bit more about the crisis link. So you said it's on the app, and if you click on it, what happens?
Well, what we found out about teenagers is they're not using telephones as much anymore. They text. And so when we looked at that, and we looked at our teens reaching out at critical times, are we there responding to them? We needed something that was 24/7. We didn't want that to be the responsibility of a teacher or a school when the text or the phone call might come in when no one's there. So again, we partnered with our county and the Community Services Board, and we linked into what already existed in our community, which is Crisis Link, but we added a text number for students. And we piloted that with 2 schools last June, and it's rolling out to all of the schools this fall. And so students can text in and they get an immediate ability to talk to someone or have someone call them.
That's terrific, and I'm sure that that is just going to be just really well used throughout our county in the coming year. Tell us a little bit about staff training and how you train teachers to recognize signs that kids might be depressed and kind of reassure parents that there's also, you know, teachers watching out for kids, teachers and counselors while they're at school.
Well, the Cognito is one thing, and so we have started with training for teachers, and that started at a couple of schools, and it's moving countywide. But another thing is we got a big grant at the state level to work on youth mental health first aid. And this is something that our psychologists, our counselors, our social workers, and our students can be trained in. And we have a plan over the next 5 years to build capacity in the youth mental health first aid, to have more and more people trained so that we can help each other recognize these signs.
Such as, what do teachers and counselors might look for in a child?
Well, they're looking for things like sadness, a student reporting feeling helpless, a student reporting wanting to hurt themselves or harm themselves. And so looking for the small things that might mean that this student is not doing well in school, that the student has has changed their normal behavior in a way that is different from what they've been doing in the past. And I really think that with the mental first aid, with the cognito, all of us are getting better at looking at what we used to think was just teenage behavior, as opposed to this is something that needs to be responded to because it's different and you have different things and ways that you respond.
Well, I know you helped to put on a community conversation on teen stress last spring, and it was well attended. It was literally standing room only. Do you have plans to do another summit?
We do. We just talked about this because it was a lot of work, a lot of collaboration with your office and the county offices, our nonprofit partners. But we actually decided that we needed to do it again. And we also need it not to be just an event, but we need it to be part of ongoing work to make all of our community, parents, teachers, and even physicians more aware of the really difficult mental health issues that are increasing among our youth.
Well, thank you so much. And it sounds like FCPS is really weaving a web of support for kids and families along the mental health line. So we really appreciate that.
Thank you. I feel really proud of the partnerships because it isn't just a school. It's the community, it's parents, it's all of us, and we've developed more, as you said, more webs to help kids.
Good, thanks so much.
Thank you.